Pompe disease is a disease caused by disorder in an organelle called lysosome. Lysosome is an organelle that helps digestive system by breaking down most of biomolecules human consumes. In lysosome, there is an enzyme called acid alpha-glucosidase, also known as GAA. This lysosomal enzyme is required to break down the complex carbohydrate glycogen and convert it into sugar glucose. Pompe disease is caused by absence of this enzyme. Since patients with Pompe disease lack GAA, they have problems breaking down carbohydrates into sugar. Unbroken carbohydrates glycogen accumulates inside the lysosome, damaging its structure and functions. Also because the glycogen isn't converted to glucose, the body eventually lacks glucose. Then, what causes the absence of GAA in lysosome in first place? The mutation of the GAA gene in the DNA of patients is the cause of Pompe disease. These mutations are passed down by the parents. This trait is represented by recessive allele, which means that if an individual receives one normal gene and one abnormal gene, the person will likely be the carrier for the disease, but the symptoms may not show. Pompe disease is shown in all different ages. Depending on the age of the patient, the disease is recognized as two different types. If the patient is a newborn baby, it is called infantile form. The disease progresses within the first 2 or 3 months of life. Rapid growth of disease weakens the muscle due to lack of glucose, and type of heart disease occurs. Pompe disease itself will show the symptoms of chest pain, irregular heartbeats, dizziness, and even sudden death. Pompe disease shown in grown-ups are called late onset form. Glycogen buildup is not as rapid as infantile form, but the disease is still progressive and can greatly affect the quality of life and decrease the lifespan of an affected person. The disease leads to mostly muscle weakness due to lack of glucose and varying degrees of respiratory weakness and decrease of cardiac activity. So, is there any treatment for the disease? One of the most effective treatments used recently is enzyme replacement therapy, which is a treatment that is intended to replace the deficient GAA enzyme. By replacing the deficient GAA enzyme with normal enzyme, lysosomes are able to function normally again with the help of normal enzyme, helping digestive system to break down